In commemoration of the World Diabetes Day 2024, the West African Postgraduate College of Pharmacists WAPCP Abuja zone has taken its annual outreach to Gwagwalada, Abuja under the theme Breaking Barriers, Bridging Gaps. This year's event aimed to raise awareness about diabetes, empower individuals with knowledge, and promote proactive health management in the underserved satellite community. Pharmacist Abubakar Daraka, a key organizer and zonal coordinator of the WAPCP Abuja zone, explained the significance of this year's theme and the decision to host the outreach in Gwagwalada. He emphasized that the outreach not only provided free screenings for blood sugar, blood pressure, and BMI body mass index, but also conducted counseling sessions to educate residents on the importance of lifestyle changes.
For now, there isn't any support, but we are using it as a platform to conduct a baseline study. For the first time, the zone, that's the WAPCP Abuja zone, is conducting 2 baseline studies. One is to know what is the prevalence in this community, because the global average is 1 in 10 adults. So our study will prove or disprove. Is it 1 in 10 adults that have it here, or more or less? We will see it at the end of this exercise. Then lastly, the other study is to assess the knowledge and practices of citizens on management of diabetes in the community. So we expect that what we are able to get from the study will inform and will give us empirical data to make informed advocacy to government, because there is need for government support, even if it is in waiving or subsidizing the screening and also the medications.
Other pharmacists also highlighted the urgent need for public awareness, revealing that the outreach targeted at least 500 residents for comprehensive health screenings and extensive counseling sessions.
The normal figure is between 3 to 6 millimole per liter, and mine was 27. It's God's intervention that I was able to even brought myself to the hospital. That if I now delay for a day or two, I might end up coming in coma. So that's the essence of this in celebrating World Diabetic Day, is to be able to enlighten the public. The theme of this year is bridging barriers and improving and gaps and empowering and global health. So the whole essence is for the public to be able to be aware that this kind of disease is prevalent in our midst, and we should take cognizance and opportunity we have that government established so many hospitals around us to be able to have access to these facilities so that we'll be able to now have a healthy life.
We need to empower patients to know their health status. When you look at today's program, we are taking BP, we are measuring the BMI, that's we are taking the height and weight of the patient, and we're also taking the random blood sugar. And we pharmacists were also doing counseling. We're counseling the patients on their health. So you can see we're trying to empower them, to ginger them, always, take at least these basic necessary vitals from time to time. So that's the main reason why the team here for this year is empowering global health.
On her part, the Director of Pharmaceutical Services, FCT Hospital Management Board, Dr. Halima Abdullahi Gero, explained the symptoms of diabetes and emphasized the importance of regular checkups.
For people who don't know, one very important thing is they feel thirsty a lot. They urinate a lot. They're thirsty, we call polydipsia, polyuria. They urinate a lot. And they feel hungry a lot. These are the 3 P's of diabetes. And a lot of them may not even know that this is the reason that they have. It is only through testing, through programs like this.
Pharmacist Danraka also emphasized the need for advocacy and policy recommendations to the government on providing subsidy for purchase of diabetic medications.
People come to the hospital when it is too late. It is at the end stage, that is with complications. They have started having things that cannot be managed. So why we try to tell the healthy individuals, the moment you start having blurred vision, that is, you are not seeing well, what you used to read clearly, you are not reading clearly now. How far you used to see, you are not seeing well again. And when you urinate easily, you pass out urine frequently. And when you have the quest to be taking a lot of water, to be drinking water, you drink water too much, and you are having loss of weight with no any reason. These are signs that are telling you that there is something that you need to go and check.
The enthusiastic turnout reflected the community's eagerness to learn and improve their health. Many residents expressed gratitude for the free services and the opportunity to gain insights into managing their well-being.
Yeah, once I have opportunity to check my health status, I do that. So I saw this opportunity and decided to take it.
I'm newly introduced to this organization, and they told us that we can still check ourselves if we have it or not. And I think, glory be to God, me, I'm not having it, but with this privilege, this opportunity, I was able to know how high the measurement of it, and I was liberated.
WAPCP Abuja Zone plans to extend future World Diabetes Day outreach programs to other underserved areas, including Nyanya and Kuje, reinforcing its commitment to breaking barriers, bridging gaps, and empowering communities through education and healthcare services. This year's outreach underscores the vital role of sustained efforts in combating diabetes and promoting public health across Africa. Follow Adeguke, CoreTV News, Abuja.